I think the most important thing the office can do is just provide opportunities and structures for collaboration around projects that bear relevance to health equity or that can impact health equity. All of our amazing students, staff, and faculty who also have an interest in this can come together and think about how they want to work together and collaborate to impact health equity. Um, and so that's really what the office will be doing. It'll be creating opportunities for that kind of communication. With regard to faculty, they contribute to teaching, research, and service. And in this tripartite mission, there is the potential to impact health equity throughout. And there are faculty already who are impacting health equity within their teaching, within their research, and within their service. It could be service to organizations outside of the School of Nursing. It could be in teaching, working with students to think critically around DEI and how it impacts nursing organizations. Within research, it can be doing cutting edge research that saves lives, for people who find themselves on the underside of inequities that are throughout society. And so, in terms of faculty and how we will engage faculty, it will really be honoring and zeroing in on that aspect of the work that they do that promotes health equity and doing whatever we can to further support it because we know that anybody who is doing research, teaching, or service in this area wants to always be able to do more, especially when we live in a country where, and a world where challenges related to health equity are profound. With regard to students and their role, a lot of students they come to nursing because they want to make a difference. They want to make a change. They see people who are sick. They see people who are suffering, and they want to be a part of healing. They want to be a part of addressing the structural determinants of health. And so, in terms of the office and how it will support students, it will be exactly in making sure that they have access to the opportunity to develop knowledge on the foundational skill sets that they need to be able to graduate from our program, go out into the world, and achieve their goals in the area of health equity. And this can be done through connecting them with faculty mentors, through connecting them with leaders through our events, through connecting them with just a range of resources that they can use to develop this capacity. And with staff, I mean, our staff impact health equity. When I think about the role that student facing staff play in the lives of students, supporting them, making sure they have the information they need to be able to successfully navigate the School of Nursing in the University of Michigan. That's no simple task, especially when so many of our students are first generation and it's the first time they've been at a campus this big. And so advisors, financial aid officers, I mean, anybody that students seek amongst the staff are positioned to support them to be able to further their goals. And oftentimes, students will confide in staff and speak in really personal terms about why health equity is important to them. And so, staff who have some knowledge and some connection to the Office of Health Equity and Inclusion will be able to connect those students to the office as well as the resources.